Well, good afternoon, and thanks everybody for joining us. You've landed at the CAF COVID Weekly Roundup. I don't know what number we're on, but we're somewhere in the 50s or 60s or something like that. Gosh, we're almost to the end of these things. I think we're probably going to do 2 more webinars. I don't have any scheduled today, so if you're looking for a registration for next week, I'll have Quaff try to work and get it up by Monday or Tuesday of next week. But my goal is to have these webinars until the final drafts of the AFLs are released. Then that way we can go over the AFLs in depth, because I know they won't be covered in depth on the HSAG calls. And then after that is those AFLs are released, and we'll talk about what those are going to look like, or what we anticipate they're going to be. We'll stop having these webinars, because I don't think once those AFLs are released, I think we're pretty much going to be at a static point in terms of regulatory guidance for a while. I could be wrong. We could drop those AFLs quickly after that, but I don't think that's the case. I think they'll kind of stay in effect for a while. So we'll talk about that in a second. The reason why I bring that up is there will probably be only 1 or 2 more of these webinars. As soon as those AFLs are released, we'll do it on the webinars, and then after that point, we probably will not have these webinars anymore. I just want to let folks know. I want to give you your Fridays back. Maybe we'll do something out different, but if there's nothing new, I really don't want to spend time, approaching other stuff. I teach emergency preparedness, and I could do that all day long on these webinars, but really the webinar's intent is to just give you the new stuff. So with that being said, today is the 28th of May. Happy Memorial Day weekend. It's 1 o'clock in the afternoon. We'll talk about the delays in the AFLs, which ones we think are going to get updated. Patty's going to talk about the NHSN reporting. If you did not see the CAF forum announcement about kind of the NHSN reporting, this is really important stuff. So Patty and I are going to both kind of tag team this, and we've also linked a number of educational resources. We'll talk about that. And then we'll talk about the CalOSHA emergency standards for COVID, when those are going to be redone, what part of your buildings do that apply to. We'll go over all that stuff. My name is Jason Belvin. I'm the Director of Emergency Preparedness, and today with me is Patty Owens, the Director of Regulatory Affairs for CAF, and as well as Summer Brazel and Jamie Berry, or Jamie Meamber. Jamie, I'm sorry if I got the last name wrong. I apologize. I get them mixed up. But in any case, we're here to assist you. If you have any questions about how to register for the webinar, please email me next week if you don't see the link, and I'll make sure you get registered for it if it's not up yet. All right, the introduction to the webinar, speakers' opinions are their own. They may not reflect CAF's official position. These webinars are brought to you as a part of a grant-funded program, and I have no financial conflicts. There is a mention of a private company in this webinar, and I'll indicate that, but I wanted to connect you with some resources out there, and they're free anyways. And the intent of the webinars is to give you a situational report, as well as some forecasting for where we see things going, and best practices where we can identify those. And these are all in relationship to the COVID-19 response. All right, so no AFLs. We're many weeks past the CMS QSOs that have kind of reduced or eliminated some of the requirements. We do expect a testing revision will be coming very shortly. That may be one of the first ones, AFL, that will be revisited. It seems likely, especially given how little new cases we're seeing in skilled nursing facilities over the last week or two. Really good news. So when that change comes, we anticipate it's going to come with the exemption for vaccinated staff to be removed from the screening testing pool. We do anticipate it will still require weekly testing for those non-vaccinated healthcare workers. And for Los Angeles County, I'm not certain what they'll do. They've had a more conservative, bent throughout this entire thing. but I think it's likely they will follow suit. They will definitely, well, I don't want to say definitely, but I'm anticipating they'll still continue the requirement to test residents, 10% of your non-vaccinated residents. I still think that will remain even after CDPH adjusts their AFLs. We do anticipate there being changes to group activities and dining allowances. If you listen to Patty and Deanne talk about the changes to the ICFs, those same changes I think are likely to occur within our facilities. So masks being able to be removed for those that have been vaccinated and not requiring that physical distancing. Obviously, there's restrictions. Those restrictions we talked about quite at length of what they're going to be on the HSAG and CDPH calls, but the restrictions will be around, if a vaccinated resident is with a unvaccinated resident, what are the requirements for both to wear source control? Same thing with the staff. There was an interesting question on the HSAG call yesterday, and it was about what if all the residents are vaccinated, but the one staff member is not vaccinated? Could that staff member wear a respirator during the course of their work rather than force all the other residents to put on a mask because of that one staff member? I'm not sure we got a concrete answer from Dr. Epson, but I will say that I think that allowance or that discussion will be contained within the AFL, and if it's not, we'll definitely get clearance on it. I think that's probably going to be maybe not a common occurrence, but it will be a frequent occurrence where you have one healthcare worker who's not vaccinated and chooses not to be vaccinated, caring for a group or overseeing activities for a group of residents that are all vaccinated. I could totally see that happening. So we'll get clarification on that if it's not included in the AFL. We do know there will be changes to the PPE requirements, when it's required, where it's required. Since the removal of the blueprint is no longer going to have those color tiers, they're going to have to come up with one kind of broad overarching policy that covers PPE use. And I'm not sure that they've decided on like, is there some step back? Is there some data or identification that we're going to use to say, okay, this is going back in the wrong direction? Now we're going to institute these more conservative measures, things like face shields or goggles in the green zone if you're a high level of community transmission. We won't be able to tell that. So how will we step back? Right now, I don't know what those are. I do know that they're thinking about that, but I'm not sure that the AFL will have step back measures. It may, we'll see. We do anticipate changes to daily reporting. I don't know if that's going to be the removal of daily reporting. We certainly hope so. We've got our fingers crossed that would be the case and go to weekly reporting rather than just daily and weekly reporting. We do know that they're going to remove a number of the waivers and regulatory flexibilities that are built in. Patty and I have both provided comments on that AFL for the removal of waivers. Many more of these AFLs, there's 88 of them from 2020 and another 21 or 20 from 2021, all of which need some revision, or I don't want to say all, but a lot of them need revision to align with the way things have changed. So it's a lot of work for them to do, and I think they're trying to do it all at once because they see this as kind of a set of operating guidance that's going to stand for a while. So they want to get it right, do it once, incorporate all of the things, and I think that explains some of the time constraints and why it's taken so long to get out. Go ahead, Patty.
All right, I just wanted to clarify on the waivers. June 1st, there is one AFL still with some waivers in it that are set to expire on June 1st, and that's what Jason was just speaking to, was those waivers in that one particular AFL. CDPH is currently revising that. There'll be a new AFL out soon, and we did submit comments And it was the AFL regarding the space conversions, licensing, like your facility licensing, renewals and fees and stuff like that. And then also services, which included the activities and the pharmacy consultant, the waiver not to have the pharmacy consultant destroy meds. So we did submit comments on those. It's the only AFL that has blanket waivers that's not extended to the end of the declared emergency. So CDPH is working on that. We did submit comments back, so we'll see how that goes.
Yeah, perfect. Thanks, Patty. And so with that, I'm going to hop in and talk about the NHSN reporting. Hopefully, if you guys are not a part of the forum or you didn't get that email, or Patty gave a great snapshot of all the things really you should be doing. And I tried to take the bullet points out of the information that you passed out, Patty, but maybe you can kind of walk us through this thing. Our understanding is that CDPH is not
Sure.
going to be adjusting their existing survey to include vaccination and therapeutics. Is that correct?
Yeah, so we did find out when this final rule came out, we did speak with CDPH, and they also expressed, CDPH stated that also on the CDPH call. They're not going to be updating the daily survey 1, 2, 3 questions to reflect the newest modules. So do you want me to just go over the slide a little bit, Jason?
Yeah, that'd be great if you could.
Okay. So you need to start submitting your data immediately. Okay, we AHCA federally and also CAF on California level, we all are recommending start submitting the data immediately for the 2 modules, which is the COVID-19 vaccination and therapeutic modules, to make sure you guys learn how to do it correctly, or if you encounter any snags or issues. And it includes facilities that have conferred their rights over to CDPH. This applies to you because CDPH will not be updating their daily 1, 2, 3 survey reporting to reflect the new module questions. So, and this is anticipation, I'm pretty sure, of CDPH backing down on some of their reporting requirements eventually, as far as daily, switching to more weekly, and then eventually going over to just NHSN reporting. So they're not going to add the new modules. You will have to go in and look at your NHSN data, and you should be doing that anyway if you've converged your rights, because there's always glitches. There's been glitches from the beginning, either on the push-pull from CDPH side or the receiving end on the NHSN side, and that can cause you to get some imposition letters sent out by CMS on non-compliance with the NHSN reporting side. So now you do have to go in on those modules. So while you're there doing those 2 new modules, we also recommend that you look at all your other modules that are required and make sure all your fields are completed on the weekly basis while you're there, and not just count on that other push-pull for that data as well. It's in effect now because the final rule went into effect now. So you don't delay in submitting, although CMS said they're not going to be imposing any fines yet. They're going to be hold off, even though the final rule went into effective already. And facilities are required to submit the data via NHSN by June 13th by midnight in order to avoid your penalties. You do not need to upgrade to a SAMS level 3 to report the vaccination data. You want to train multiple staffs to have knowledge of the process to prevent gaps in reporting, but we already know that. I mean, we've been reporting already, so it's not anything new for us. It's just new modules to report. Here's some training sites for the training. Again, ACA and CAF both recommend you guys all do this training, and don't wait, start now, because you're going to have questions, and making sure that you do accurately and not receive any of the CMS imposition letters and fines and deficiencies related to that.
Yeah, and I'll just on a anecdotal note, I work on the HHS liaison team, and you know, we haven't had this kind of requirement like the hospitals do, and the hospitals have this same kind of requirement, or actually much more stringent, but they're very aggressive with their with their enforcement. So I'll just leave it at that and say I don't know that our experience would be different, but they're very aggressive with the enforcement with the hospitals. So we want to make sure that, you know, I know this is time consuming and things like that, but we definitely these folks will give you a CMP. That's my point. If we want to pay attention to this, we don't want to put ourselves in potential for a CMP. So, and Patty, these training modules are the ones that you cited. Are they the CD or CDC training modules for each form? Is that what these are? These links?
Yeah, these are on how to collect the data, instructions on how to collect the resident data. There's forms to use. There's all kinds of tools and resources surrounding it. But it's great education. Take away from it what you plan to use, what you don't plan to use. It's not mandated that you use their form to collect the data, but it's all set up and designed to help you be successful with data to gather and how to get it in there correctly.
Yeah. And so, Patty, if providers said, well, if now I have to do the vaccination and the therapeutics, I might as well do the other stuff. Can they now do that, or do they have to now go back and try to get that SAMS level 3 card if they didn't?
I didn't really understand that question, Jason. Can you say it one more time, please?
Yeah, so for the other reporting that's required by CDC through NHSN, the reporting that CDPH is gathering and then uploading for us, if the providers now want to input that information themselves, if they don't have a SAMS level 3 card, would they need to get a SAMS level 3 card in order to start inputting the rest of the data themselves?
I think there was some of the reporting, Jason, a while back, I believe, that needed the SAMS level 3. I'd have to look back on our prior forum post, but that's a great question. I think we can get some clarification out on that as well.
Yeah,
and you're specifically probably talking about the ones that have conferred their rights if they want to start just doing their own reporting in NHSN.
Yeah.
So we can look at that and we'll put something out on the forum.
Yeah, I think they can go in and make changes to what CDPH has already done, but they have to.
Yes.
I think they have to have that SAMS level 3 to be able to get into it, but I'm not certain. So for you guys, if you've conferred your rights and you don't have that the ability to add information in, there could be some point if CDPH is no longer doing daily surveys, they may require you to do the NHSN, all on your own. And so I'd like to at least have you guys, one, make sure you have access to be able to do all of it if you need to, and two, understand what the process is. If CDPH decides we're no longer going to roll this information up, we don't have the same, we're not trying to gather the same data as NHSN. And if that's the case, then it's going to fall on you guys to do both. And I just want you to be comfortable with the data entry. And that SAMS level 3 at the beginning took a long time to get those cards. So
yes.
So if you've not done it, maybe start on that now.
Yeah, I think you put out on the forum a while back. We can find that all, Jason, for everybody on this call. We can resend that out to everyone, how to do that, the process for it. That out again to everyone as a reminder.
Okay, perfect. Thank you, Patty. I appreciate it. All right, so I want to talk about the CalOSHA emergency standards. Not sure if you guys heard my discussion on the conference call yesterday, the CDPH conference call. I'll just say this, that we've had conversations with a number of attorneys about the CalOSHA emergency standard, what applies in skilled nursing facilities and what does not apply. And for those that would normally be subject to the emergency standard by CalOSHA, are there things that we can do where we're not trying to do two different standards at once for different employees? So one, we know those emergency standards that CalOSHA has released were set to be revised. They postponed that revision and they wanted to see, wait until CDPH had removed some of the requirements for workplaces, general workplace requirements based on the CDC guidance. Since there were changes from CDC that were not incorporated into the proposed revisions, the CalOSHA Standards Board voted to postpone the vote until CDPH had released their guidance. Most California employers were represented at that meeting, and I'll say for us, generally within the rule, you can see that last bullet point on the slide, that employees who are covered by the ATD regulation are not subject to this emergency standard from CalOSHA. The problem is not everybody in a skilled nursing facility would necessarily be subject to your ATD policy. And I'll kind of explain the differences and how you can kind of get around that. So we do anticipate there's going to be some guidance around a requirement for universal masking, possibly in all workplaces. We heard employer groups asking to have all employers provide respirators for all employees in every workplace setting or indoor workplace setting. That was a suggestion. There's the list of comments was pretty broad, and they you know, for both employers and employee groups or labor groups and things like that. So what that change is going to be, I don't know, because the standards board has got to weigh all this and come up with one set of guidance. What we do know is that we still think that the exemption or the exception to the rule is those who are covered by aerosol transmittable diseases, as well as anybody who is working from home. So those would be two exceptions to that. There's a third exception for a single employee, but that doesn't really apply to our space. In the ATD standard within the state of California, really divide things up into two buckets. We have receiving providers and we have referring providers. 90% of you guys, maybe even a higher percent, are what we would call referring providers, meaning if you discovered a case of TB in your facility, you're not going to keep that person in your facility. You're going to transfer that person to a facility with the ability to quarantine and contain that highly infectious disease. So that's the way the ATD standard is designed. It's designed to have some flexibility for those that may have occasional occupational exposure to aerosol transmittable diseases and a procedure to deal with those in a manner that gets them to a receiving facility. Now with COVID, that ability for you to refer those residents out was removed back in May of 2020 or April of 2020. Essentially, you can't transfer them out. So that essentially changed the ATD standard from you being, I mean, you're still a referring provider, but now everybody has occupational exposure. And so the question is, do we continue to use our existing ATD standard and the folks that are with the occupational exposure to airborne infectious diseases, think care staff, EVS staff, folks that are within that 6-foot bubble of the resident, those folks, obviously, we know they have to be in our model respiratory protection program. They have to be fit tested, go through that medical evaluation, all that stuff. You can universally say everybody in my building has occupational exposure, and I'm going to incorporate them into my model respiratory protection program. I'm going to fit test them. I'm going to get them medical evaluations. You can do all that and put that into your plan, and that would exempt you. But then everybody in your building is subject to that ATD standard. And that means that they have to have annual fit tests every year. You usually don't have to redo the medical evaluation unless there's a change in health of the employee. But my point is, it's not something that would normally apply. And after the pandemic is over, really, there's no reason for, outside of emerging infectious diseases or pandemics, there's really no occupational exposure for a biller or for an admissions coordinator or somebody like that. A lot of that work can be done without occupational exposure. And so if you write all those people into your plan and say everybody that's employed in this building, it goes through fit testing and they're a part of our ATD standard, then that's fine. You don't have to do that. But once this is over, you're going to have to look at, is it really appropriate for me to fit test every single person in the building every single year? Is it appropriate for me to have 45 days of supply for everybody that's been fit tested in my facility? Because that's coming down the road. So I think it's a good, maybe temporary fix, but you got to remember to go back and change it back once you're done, because I don't think that that's a sustainable model ongoing. Anyways, there is a FAQ on the emergency standard. If you guys choose not to incorporate all your staff into your model respiratory protection program, and you want to model for the other folks, they have to follow the CalOSHA standard. That CalOSHA emergency standard is very, very similar to what we already are required to do. That's why it's not that big of a deal for you guys to kind of accomplish, but certainly you are subject to that, and there are some slight differences, and the FAQs are right there. And I mentioned the exceptions and kind of those exceptions. That was the argument I got in with the surveyor yesterday on the call, if you weren't aware of it. But you definitely, if you've not written every single employee into your model respiratory protection program and said, done all those things, you're either non-compliant on the ATD standard or non-compliant for the emergency standard. But you've got to do one or the other. That's the choice. So, Patty, did you want to add anything else? I know sometimes I blaze through that, and I want to make sure I didn't miss anything.
No, Jason, that well presented. I don't have anything to add. I mean, if anyone has any questions at the end, certainly put them in the chat and we can try to answer any questions.
Okay, perfect. Thank you. All right, so I just want to mention a couple of things that are upcoming. Reddinet has a webinar. Reddinet is in a lot of counties. This is specific to Los Angeles County. So if you've never registered for Reddinet, you don't know what Reddinet is, or you want to learn more about Reddinet, or maybe you're not strong on your data entry skills, or you need a refresher. There's a webinar for non-acute providers, meaning skilled nursing and clinics and dialysis and hospice. All those folks are welcome to join this webinar. The webinar is free. The service is free for those facilities in Los Angeles County. So you definitely want to participate. This is your primary method of communication with the county during a disaster. And so one, we have a regulatory requirement to be a part of that, be able to have a ability to share that information with them. And two, this is Los Angeles's primary method of communicating with you in the event of a disaster. So we want to make sure that you are registered for that and understand how to use it. In terms of litigation, I know this is, we're hearing obviously more and more litigation, and we anticipate that's going to continue for the next few years. If you're wondering, like kind of an intro into things you should be considering, I found this webinar pretty good. Now, I'm not paid by Lockton. I don't have any professional relationship with them, and they certainly didn't pay us to put this on here, but they've been an active contributor to our disaster conferences for many years, and I wanted to bring this to your attention. I'm familiar with the presenters, Bill Wilson and his partner. I've listened to them speak at many CAF conferences. Great information on how to prepare for litigation and how to engage and involve your attorney, best practices, things like that. I found it very helpful. For a layperson, I think it would be a good recording to listen to, and it's free of charge. And there's the link to the meeting. We're having many of you guys, I don't know if you know this, but we have, normally every other year, we have a Really Ready 2-day disaster preparedness conference. And generally, this is the largest disaster preparedness conference specific to long-term care in the country. We have multiple tracks. We have an ICF track. We will do it very similar to the way we did it down in Anaheim a few years ago. We are seeking abstracts, so if you have best practices that you'd like to highlight, maybe a way that you did incident command in your building, or a way that you did communication to families, or the way that you utilize technology, to help meet the needs of your residents during a pandemic. All those kind of things, I want to learn more. One, for my own edification, but two, I really like to have providers share things that actually work in the field. As attendees, we'll probably gather more from those folks than you will from somebody that speaks about theory or something like that. So I'm always interested to hear about your guys' experience, and I want to see if you're interested in presenting about that. Even if you're not comfortable presenting, if you have an idea for something that should be covered. And obviously, we're not going to talk about just COVID. This is disaster preparedness. We'll talk about it all. But I'm certain we'll cover emerging infectious diseases and some of our successes and some of our challenges as well. So we do have sponsorship opportunities. So if you know of or anybody that works in an associated field, either disaster preparedness, fire and life safety, anything like that, industrial hygiene, if you have any of those companies that you do business with that you think may be able to help us with sponsorships, I like to do this. I don't get any money from the state, I get a very small amount of money from the state to be able to do this conference. So this is the only conference that I hold, or only training that I hold, that has a cost associated to it. So there will be a cost associated to it. I mentioned it's 2 days, it's multiple tracks. We will do multiple exercises during the conference so that you can have at least one of your exercise requirements met for your CMS requirement. And the last thing I want to mention is, if you're attending your Healthcare Coalition meetings, I would ask you to ask your Healthcare Coalition coordinator if they have the ability to pay for you to attend the class. We've had that. Many of the healthcare coalitions are eager to help pay for you to get education. You just have to let them know this is the education you want to attend. It will be in April of 2022. It will be in Southern California. I'm looking at locations in both Los Angeles, Orange County, and maybe Western Riverside County, but in that kind of general area, which gives us the broadest reach for people to both drive and fly to. And speaking of healthcare coalitions, if you haven't already, your HVAs, or your hazard vulnerability assessments, should have been submitted to your healthcare coalition so that they can build their coalition HVA. And that coalition hazard vulnerability assessment is what you're going to need for survey. So you definitely need something from them, but in order to get that, they're going to ask you to provide your own individual HVA. In terms of the vaccine stragglers, here's a new thing. I'm certain you guys have seen this in the news, but there's a lottery essentially for folks that have chosen to get at least one dose of the vaccine. If you have staff members that are on the fence or close to getting it done, maybe this will push them over the edge. There's opportunity to win a bunch of money. And for those of us that were early, we are included too. So everybody that has got at least one dose of the vaccination and they've been registered in the immunization registry, they're going to have an opportunity to be drawn. So that's all good news for us. Hopefully next time we talk, one of you guys will be a millionaire. Who knows? You never know. So, all right, I'm going to hop to the questions and see what we got here. Give me a sec. All right, as we field more requests for vacations, can you update us on the latest travel guidance, specifically from international travel for both vaccinated and non-vaccinated? I'd have to go back. I don't know if it's changed since the last time I presented. I think it was 2 or 3 weeks ago. I'll have to go back and look. I know what it was the non-vaccinated did not have to be excluded from work. I know that the recommendation was if they do international travel, that they're tested between day 3 and day 7, I think, upon return. And then for the vaccinated folks, the non-vaccinated folks, I think it was testing, and I can't remember if it was a work exclusion. Kevin, I'll pull that up. I'll make sure that I cover it on the next call. I know that link that was on the webinar is still active. the CDC link for the thing. I haven't seen it change, so I assume it's the same. And I'm on a million listservs for the CDC. Generally, they're pretty good about sending updates, but if they move where the update was moved to, then I don't get the notification. So I'm sorry, I don't have a concrete answer. I think it's the same as it was 3 weeks ago.
I think it's the same too, Jason.
Yeah, appreciate that. Thanks, Betty.
Yeah, I just wanted to.
So is the recommendation to add everyone in the respiratory program to be considered fully compliant? Yeah, so the attorney that we talked to said that that was a strategy that he had experience with his clients across the state, that it was easier to just add everyone into the into your model respiratory protection program. If just remember, if anybody's left out of it, whoever's not in it is subject to the emergency standards. So if you're going to do it, it's like all in, or just keep it the way you are and try to figure out the dual process. If you are doing that, where part of your facility is subject to the emergency standards from CalOSHA and parts subject to your model respiratory protection program, then when that changes, that's going to change for those employees too. So if you put everybody in your model respiratory protection program, that is going to stay. That's not going to change. You know exactly what you're getting into. It's just that remembering that that may not be a good long-term strategy, but for the short term, maybe that's your best bet. So, all right, I don't have any more questions, guys. If you have questions, obviously, please feel free to add them in. We're running out of things to talk about. Hopefully, in the next week or two, I'll be presenting the last of the AFLs, and we can, kind of finalize our response, or at least, step these things down. And I want to encourage you guys, if you speak to your healthcare coalitions and there's any discussion about doing an after-action review or an after-action report as a coalition, I highly recommend that you or one of your staff at least volunteer to be a part of that process. It's really important, especially if you have feedback that's either positive or negative. We got to get these things listed so that some of these things that we can mitigate if this happens again, we can put those in place, and some systems that we can develop for the next disaster. It doesn't have to be a pandemic. It could be, an earthquake or something else. So I think it's important, if you guys get that opportunity to participate in that after action review with your counties, I highly encourage it. So Patty, do you have anything else you'd like to share before we leave today? All right. Hearing nothing, I hope you guys have a wonderful Memorial Day weekend. If you get 3 days, hopefully it's not too hot where you're going to be, or maybe have a pool there or something like that. So anyways, take care, guys. Have a great weekend. We'll
take care, everyone. And no, Jason, I didn't have anything to add. Sorry. Everyone have a great weekend.
You too. Thanks, guys. Bye.